and welcome to our Good Sound Happy Hour. Today our fabulous guests are Dr. Bustillo and Dr. Berger from Bustillo Physical Therapy. Cheers.
Cheers.
Doctors, welcome.
Thank you for having us.
You're very welcome. So we usually start off talking about our wine, so let me have a drink. All right, so this is a Pinot Noir from Raptor Ridge. Is that right, Elena?
It is.
This is actually a vineyard I've been to in Oregon, and do you guys drink much Pinot Noir?
I do.
Yeah. So you probably know then, Oregon makes fabulous Pinot Noirs.
Yes.
They're amazing. This was one of my favorite vineyards in Oregon. I'm curious if anybody else has a favorite vineyard in Oregon, because we try to go every year and try different ones. But this was lovely. First of all, it's beautiful. So if you want to go sit out on the deck, it's gorgeous. And they also just had really, everything I tasted that day, it's one of the few where I actually did join the wine club. Because if you know you do like tastings every day, you can't join every wine club.
No.
So we joined the wine club, and this is some of what they've sent me. So it's quite fabulous. It says actually that it pairs, this is a 2012, it's one of their reserve. In Oregon, their reserves actually are something, whereas in parts of the country, a reserve in America doesn't mean anything. It just means they're going to charge you more for no reason.
Sure.
Oregon, the reserve typically means it is something special. And so this is a 2012, and it's lovely. It says it pairs well with risotto, but we don't have risotto today.
Not today.
We have cheese and crackers. So anyway, if you are wondering why we have physical therapists with us today and how that plays into our Good Sound Happy Hour, in the field of audiology, when I was in school anyway, we were all together, the PTs, the OTs, the audiologists, the speech pathologist. And if you're joining us, you're probably wondering, well, why are you having physical therapy here for hearing aids or hearing loss? And part of what I do, we have a lot of patients with balance disorders. And there are audiologists who will do certain maneuvers and such, but for obviously falls, off balance, and obviously there's probably some things we could both are trained to do, but vertigo, these are the people I would refer to. So again, I'm Dr. Jessie with Good Sound Audiology. And today we have the physical therapist from Bustillo Physical Therapy. This is Dr. Bustillo and Dr. Berger joining us today to kind of talk about how balance and audiology, the field of audiology and physical therapy interact, kind of exploring those. So I don't know if you guys know this, I know you know this, but your balance system is actually located in your inner ear. So a lot of patients will actually be referred to me for a hearing evaluation, and they're kind of angry because they're like, I don't really know why I'm here. My hearing's great. And what they don't appreciate, and you'll learn this today, is really that hearing evaluation is almost like an x-ray of that inner ear and of that balance system. It gives us really good information. So obviously there are different types of balance disorders, and you guys can kind of speak to me a little bit about which ones you treat, or maybe it's all of them. So typically when I'm talking to patients and they're telling me about their balance problems, I try to figure out, is it a lightheadedness, is it a off balance, is it a spinning?
Sure.
So let's just kind of start with that. If it's, well, I'll do a little talking at first and let you do some, because I really am getting somewhere with this.
Okay.
So typically if it's vertigo, that usually is a problem that's coming from the inner ear, and there are certain maneuvers that I could do or you guys can do, and we'll talk about those, that can help with that. That's a spinning sensation where either you're spinning or everything else around you is spinning, and we call that vertigo. If you're experiencing that, they're probably going to send you to me because we're going to do a hearing evaluation, because again, from that test, we can get a good idea of we can get good information about the inner ear. Then there's just off balance. Now, again, off balance as far as my treatment, the only thing I can say is that when people wear hearing aids, they actually have a better sense of balance.
Sure.
All right? The lightheadedness for me is the hard one, because probably wearing hearing aids, doing an Epley maneuver, things like that are probably not going to fix the lightheaded. So again, there's always a little bit conversation regarding when is that occurring, what medications, and things like that. Do you guys see all three of those categories, or more of one or the other?
Yes.
Yeah?
I consider lightheadedness to be on the spectrum
Okay.
of vertigo. So lightheadedness to me is that very mild case, and you can take it all the way up to where the room is spinning and you're vomiting and can't move because the room is just not happy.
Yeah.
And so when you have someone who has lightheadedness all the way to the vertigo, maybe we can talk a little bit about that. there different exercises you're doing with them? And B, is the prognosis different, or the treatment plan, like how long is it going to take to get better?
Sure.
I know you're speaking
Absolutely. Yeah, no, I would say it definitely varies, obviously, from individual to individual, but getting a thorough kind of subjective interview of what their actual symptoms are, and then not just performing vertigo testing, but also assessing kind of like the soft tissue mobility of necks and suboccipital musculature kind of can play into some of the lightheadedness or dizziness feelings that people are getting depending on how chronically tight or if they have any cervical spine degenerative issues, something in that nature. So we always take a look at that as well. Then exercise-wise, depending on where we feel that they're lacking balance, whether it be statically, so in sitting or static positions where they're not moving, or dynamically, whether it be in standing or during walking, then we try and challenge them depending on where we find their weaknesses. So whether we feel that it is coming from the inner ear itself, we're also very reliant on vision for balance, so we kind of play that into rehab, and then feeling within the feet, so getting people used to firm surfaces, but also challenging them on unstable surfaces and things like that as well, just to kind of reset anything if there was something in the inner ear that was off, but is now maybe fixed by prescription of hearing aids, or was fixed by repositioning of the crystals, then you kind of just want to reset the body and get everything functioning as one again.
So, and I think that kind of what you just spoke to is where our fields can interact with each other, because I'm not going to do physical therapy. There are maneuvers that I'm licensed to do, but I don't even do them. I would much prefer to refer. I would prefer to refer to Dr. Berger or Dr. Bustillo. I had actually, I don't know if she's watching. Let me actually back up for a second, reintroduce ourselves. I'm Dr. Jessie with Good Sound Audiology, and welcome to our Good Sound Happy Hour. Today, our guests are Dr. Bustillo and Dr. Berger from Bustillo Physical Therapy, and we're just talking about, really mostly today, I think we're going to focus on balance disorders and the spectrum of that. I had a patient yesterday, and I said, oh, if you watch tomorrow, I'll try to talk about you and ask about you. So it wasn't really planned, but I think we're good. She's had vertigo. She has been given meclizine, which is just a pill that helps suppress those symptoms, but it just makes you hopefully suppress the dizziness, but you still have it. It's not a treatment. So in that case, I think most physicians would still make the referral to physical therapy. She's had the epi done, which is a maneuver we do to reposition the crystals in the inner ear, and for many people, it's a pretty quick fix, and life is wonderful. So again, you can always ask your physician. You call my office, ask about that. Again, it's treatment for a very specific type of dizziness. If you're just lightheaded or you're off balance, that may not work for you. But she had this done, and I think had some success. It has now represented, and she's wanting to know where to go. And I said, I have some physical therapists who might be able to help you. So again, you don't know much at this point. You know you have a patient. It truly is vertigo. It is a spinning. She's physically ill. She's a little bit better a few days later, but it's with movement. When she moves a certain way, when she lays down. Tell me a little bit, just with that limited information, how you would handle that patient. Either one.
Well, with anybody that has repeated episodes, or sometimes what I consider chronic vertigo, I really delve a little bit further into their history. Do they have allergy problems? Do they have sinus problems? Have they had sinus surgery? Have they had repeated TIAs or transient ischemic attacks, mild strokes? Things that really can impact your balance center, that vertigo, spinning feeling, and repeated illness. Repeated illness tends to affect the inner ear and keep someone in symptom longer than they want to be there. And so delving into that history a little bit further really does help create a better picture for how to treat them.
Okay.
And then we go to positioning them. So if the person has a positional problem and we can fix that problem with an epi maneuver, we do that because it is such a good, quick fix.
And do you have to do that repeatedly?
It can be done repeatedly.
So 2 times, 10 times? What does that look like for someone who may be watching this? I mean, does it really range, or is it really 1, 2, 3, 4 times?
Usually it's pretty, no, it doesn't range too greatly, I wouldn't say. I would say within 3 times of having a patient come in consistently and doing the epi maneuver, still on that note, getting a positive kind of Dix-Hallpike test would kind of guide my treatment in that way
Okay.
to identify kind of which side is the problematic side versus which side we don't need to be focusing on at that time. But I would say 3-4 visits of consistently coming in and having the repositioning maneuvers done. Like you mentioned, it's called the Epley maneuver, and if they're not getting much of relief from that, then we really kind of start turning our wheels to try and figure out other symptom generators for that kind of a chronic vertigo.
Right, because typically with that, my experience has been patients see immediate relief.
Absolutely.
Yeah.
I would say
It's-
90% of the time.
Yeah, it's immediate
Mhm.
relief. And then if you don't see that, I think what you're saying is you kind of got to start looking elsewhere because
Right.
there's either something else contributing or something else is probably going on.
Yeah. And even some people, they could have it in both ears at the same
Yes.
time.
Yeah.
And we can't treat both ears at the same session just because it has tendency to undo what you do to the one side. So
Right.
that would be another cause for multiple visits in that kind of a situation. But
Okay.
yeah.
And to get to you, you guys take most insurance companies.
We do. We
Yes,
do.
you
There's
do.
very
Okay.
few we don't take. And Arizona happens to be a direct access state, meaning that patients can come to us without referral from their physician for a at least a consultation.
Yep.
Oh,
And-
that's fabulous. I didn't know that.
We have a question.
Okay.
Can this maneuver help people with vertigo due to cancer treatments or therapy?
Okay, so the question is, for those of you who might not have heard that, can this type of maneuver, it's called the Epley maneuver, help patients who have vertigo resulting from cancer treatments? Is that correct, Elena? I'm going to let you answer
I'm going to let
that.
Karen answer that. She's our cancer
So,
specialist.
there are a number of medications that are ototoxic
Yes,
that really
yes.
do disrupt the inner ear. And antibiotics are one of them. Chemotherapy medications are another subclassification of medications that do affect the inner ear. And yes, with an evaluation, certain people will respond very positively to an Epley maneuver due to medication-induced vertigo.
Right. And I think sometimes, unfortunately, well, I don't know. Usually if it's truly this vertigo, there is testing. I don't actually do it in my office. Like I said, you'll probably start with a hearing evaluation, which just annoys everybody. Because they're like, my hearing's okay. Why do I have to do this? Again, a hearing evaluation, if you have dizziness, it's a good idea to get your hearing evaluated. It just gives us really good information. Then we build on that. As Dr. Berger referenced, there's some testing we can do where, sadly, we try to stimulate the vertigo, although it's very controlled. And with that, we can measure it and we can get a pretty good idea of what's causing it. Is it truly an inner ear problem or is it a vascular problem? Karen also mentioned, Dr. Bustillo mentioned that there's a really, there are definitely some drugs that are very much ototoxic, meaning it can damage that auditory nerve and subsequently we can end up with some dizziness issues as well. I think you're going to start off with probably your primary care, as most of us do when we have a problem. And depending on your primary care doctor, you're going to get to different places and probably in different orders. Some actually will now refer, just because I've been in Gilbert so long, for example, we've been here so long, they just come straight to me. And then I can make a referral to an otologist or an ENT and physical therapy. But I think often sometimes it is a combination of the exercises and sometimes medication. I mean, what often happens with some of my patients, as you guys know, it's Friday afternoon or Saturday morning, they wake up, they're spinning, they literally can't get out of bed, and it's terrifying.
Right.
Yeah, and on that note, they go to the emergency room,
Yeah.
and so many people, unfortunately, are not versed in just this simple technique that could alleviate someone's problems in the snap of a finger, but rather they work you up and go through all these scans and go through all this stuff, whereas it could have just been as simple as one of the...
Right, and I think initially there's concern about the heart.
Absolutely.
sure.
Once you rule out a stroke and once you rule out a cardiac condition, then vertigo tends to be the next most common diagnosis.
But you're right, I don't know of any, although I could be wrong, ERs that do these maneuvers.
Exactly.
Yeah.
But what they will do, again, it's terrifying. So people, they call an ambulance, they can't drive, they can't sit up.
Nope.
Not everybody has it to that degree, but often it presents that way. So, many people go directly to the emergency room because it always happens on a weekend.
Oh, yeah.
Or after hours. So they end up there, and they typically, after, like you said, they clear everything that's really life-threatening. they will put you on a medication that will help suppress these symptoms and just hopefully. Now, sometimes with time, you will just have recovery.
Yes, absolutely.
But again, sometimes this is so debilitating, you're not going to sit around for 2 weeks waiting on this.
Sure.
There are diseases that can also cause vertigo, not the benign paroxysmal, it's actually BPPV, benign paroxysmal positional vertigo that we treat with the Epley. But there are some diseases that can cause vertigo. For example, Meniere's disease.
Yes.
My mom has Meniere's. Meniere's, you will almost always end up in the audiologist office at some point because you often will have fullness in your ears. You will have vertigo. You could have some ringing in your ears. Often it's just one ear, although it can be two. And that hearing loss, it's actually one of the few things we see where we have a fluctuating sensory neural hearing loss, and it will bounce up and down, and that is not typical. The sad thing with Meniere's, I don't know if you guys see many Meniere's patients.
We can't treat it.
Yeah.
It doesn't respond.
Yeah. Okay. So I get a lot of Meniere's patients, and my own mother is like, how come you don't cure this already? But the hearing loss will fluctuate, and from the audiology standpoint, it used to be a really frustrating disease because 15 years ago, you've got this hearing loss. So again, your physician's going to manage the dizziness, and you're going to be on, and it comes and goes. You'll have periods where you're completely fine. Some people, it pops up every few months. Some people, it's once every 5 years. But when it hits, it's pretty debilitating, and you'll have vertigo for a few days. With the hearing loss, though, it's really frustrating because 15 years ago, you'd have hearing loss, we would fit you, and then the hearing would completely change.
Yeah.
Sure.
Now, today, thankfully, we have hearing aids that we can just reprogram.
Oh, thank
But,
goodness.
yeah, but for many years, you didn't. I mean, you could do a little bit of volume control, but essentially it was like, okay, now you need to spend another, back then they were $1,000. You need to spend another $1,000 because this hearing aid you bought 6 months ago is no longer appropriate.
Yeah.
So that's not the case anymore. We can at least treat the hearing loss even when it fluctuates. You don't have to buy a new hearing aid, and we can manage that, which again isn't going to treat the vertigo, but when you have better hearing, especially both ears, we definitely have a better sense of balance.
Yes, and you negotiate the world much more easily.
Absolutely.
And with the better hearing, it's just a question of getting someone used to their better hearing. So again, challenging them in environments where they're like, oh, I can rely on that inner ear now to kind of help me with balance rather than being...
I actually have, in fact, if I joke with some of my patients, because I should do a study on this because truly I think I could be a billionaire. I have golfers. It's Arizona. We have a lot of golfers. And they get hearing aids, and they go out and they play a much better golf game.
Maybe that's what I need.
There you go.
Yeah. So it's always, I'm like, that's because of your hearing, and they don't believe me. But I've heard it enough that we know there's a correlation. But I also will, on a side note to that, they can hear the ping of the ball.
Yes.
So the hearing the way they hit the ball. And so, but it's kind of, my serious golfers, really, I think, honestly, hearing aids are so expensive. I'm like, oh, they're $7,000. I think if I were able to say with confidence, but you'll have a better golf game, they would just be like,
sure.
They would get 2 or 3 sets. They're like, So it is funny, but just kind of playing off the whole, balance situation. So we talked a little bit about Meniere's, which again is going to have a fluctuating hearing loss and periods of vertigo. And I didn't know. Actually, that's really good information for me. I didn't know if you guys managed those patients or not, or if it really just, there wasn't much you could do.
Well, and actually, some of the things that I find is that when people deal with their lightheadedness and their vertigo, they actually say that their subjective hearing is better when those symptoms are managed. And that really helps them quite a bit.
Right. Well, it's just like, you can hear better if you've got your glasses on.
Yeah. I knew that.
I think it's the same thing. The other thing, obviously, and I know you guys work with this, and I would love to learn more about this, because this, I just refer right out the door. Part of our aging process is going to be a little bit of loss of balance. And again, as we age, we lose our hearing, so it's kind of all tied together. So let's say I have a patient here who's doing everything right. They've got their glasses, they're wearing their hearing aids, and they still struggle with balance. And, that's scary because we know falls are, I think, are they still the leading cause of death in the elderly? So, and I'm really in trouble because I'm a faller. I've been a faller my whole life. I break ankles, I break wrists, I run, I trip on a pebble. So as I age, I think this is going to be more problematic for me. But if I have a patient who just says, I just struggle with balance, let's say it's a 70, 75-year-old patient, they're pretty fit, they wear their hearing aids, so they're doing everything they're supposed to do. Could I make a referral to you? Would you be able to help this person?
Absolutely.
Yes.
Okay, so tell me what that looks like.
So with an assessment, really what it would entail me assessing is kind of what balance conditions they're most lacking. So whether that be in dim lit conditions or well lit conditions, giving me a sense that maybe they're more reliant right now on their vision. So I would want to challenge those systems, doing exercises, eyes open, eyes closed, kind of varying things that way. Testing inner ear function to see if it's, even though they're hearing well, is maybe still their inner ear a cause of the balance issue. So putting them on firm surfaces where they're not necessarily reliant on vestibular because they can see vision and things in front of them, but putting them on more unstable surfaces where they're not getting real good information from the bottoms of their feet, so they have to rely on their other systems to kind of bring things into perspective. And then a lot of it also has to do with like general strengthening. So people will come in and be like, oh, I'm strong, I feel strong, which in fact maybe static manual muscle testings do turn out to be fairly strong.
What does that mean? What's static?
Just in giving them a quick, okay, resist me real quick, and just seeing how quickly their muscles engage and if they're able to resist the pressure that you're putting through the limbs. May be good at first impression, but then when you have them start doing an activity, they start to fatigue really quickly, or the endurance through their limbs is not very good, which again, you can see how that may lead to a fall if they're out walking in a grocery store. Yeah, they can make it in from the parking lot just fine, but once having to go through the aisles and pick up some groceries, that level of fatigue just gets to you, and then it decreases safety as you continue the journey. So challenging balance in different ways, and then working on just general strengthening if the need exists is kind of how we would address patients referred for those issues.
Okay.
And we also talk about footwear. Arizona is the home of the flip-flop.
Yes.
And all types of sandals. And so addressing really properly
it's so
fitting
simple.
footwear. Yeah, it can make a huge difference. Some people get very soft, cushy shoes, and that's too soft for them. They need something that's a little bit firmer. Some people, because they have foot pain, need something softer. And so there's really a lot of things that go into a good footwear assessment.
Again, wouldn't even have thought of that. For those of you who are just joining us today, welcome to our Good Sound Happy Hour. I'm Dr. Jessie with Good Sound Audiology. Today our guests are physical therapists who are really giving us great information on balance disorders and vertigo, things like that. This is Dr. Bustillo and Dr. Berger from Bustillo Physical Therapy, so thank you for joining us. Our wine today is a Pinot Noir from Oregon. If you have a favorite vineyard in Oregon, I would love to hear about it because I try to go once a year to visit, and I'm always looking for new ones. Back to, we were discussing falls within the elderly. I just have a question. If you have someone, let's say like me, I said, oh, I'm a faller. I don't just fall usually. I fall when I'm running. So does it matter if you have a younger person versus, let's say a 6-year-old versus an 85-year-old? Besides, obviously, you're to do lighter weights. Does the treatment change based on age? Or is it just the weight, the resistance amount? Or would it be the same?
I wouldn't necessarily classify it by age. I would just say that it differs per patient's abilities. So obviously, someone's ability, no matter what age there are, could differ between me wanting to do challenging kind of quick dynamic work outdoors versus someone like, maybe someone wouldn't be up for that and I need to keep them indoors and do kind of. So I wouldn't say necessarily based on age, but based on ability for sure. I would tailor the treatment to kind of.
Well, right. Because again, I've
and
got
their goals.
I've got 80-year-olds who bike their age.
Oh, sure,
and
absolutely.
40-year-olds who don't leave the house.
Exactly.
So that's actually a very good point.
And in your situation, I mean, you're very into running, so that would be something we would want to really challenge and focus on to get the balance reactions working well in that regard. Whereas someone's your age may not be, they don't care about running, so they're not really interested in an activity like that, but maybe something at work bothers them, so we'd want to mimic kind of work conditions in that regard and get them functioning well.
Well, and for me, not all my falls, but when I started falling kind of consistently, it's kind of like you said, you don't think of the obvious things. I had changed shoes to a different brand, And the other thing was somebody said, and this was when I was hitting 40s, your eyes.
Sure.
Yeah.
And I actually went out and got prescription glasses, and knock on wood, I haven't fallen since. So when I run now, and truly I would see a curb, I'm like, oh, there's a curb. And I would just, you know, and I'm like, I saw the curb. How did I do that? But, you know, things like that, which you don't think about. But, you know, so again, visually and again,
Exactly.
the
Yeah. And with
shooting.
someone whose complaint is falls, you always question, when was the last time you had your hearing checked? When was the last time you had your eyes checked? Things like that. So it's very common
It's
in our
amazing how it's all tied together.
interviews.
Because again, my patients are like, oh, I tend to, you know, I'm someone who does fall. I'm off balance. And a lot of my patients, if you say, well, when's the last time you had your hearing checked? They look at you like you have three heads, like,
Yeah.
no, my hearing's okay. It's my balance
Yeah.
that's
Right.
off. And there again, your balance system is located in your inner ear. For those of you who are just joining us, Elena, we had a question.
You did. Somebody's asking about what a VNG test is, and do you do that?
So somebody asked, what is a VNG? A VNG is a procedure. It's actually short for vestibular, oh my gosh,
Nice.
nystagmography. Thank you. I can perform them. I currently do not in my office. It's a fabulous procedure because it's going to help ascertain what's causing your vertigo. Is it an inner ear problem, and which ear is it? With that information, then these doctors can obviously more effectively take care of you. We referenced it a little bit. It's different tests we do. We try to figure out if it's a central problem or if it's truly an inner ear problem, where that dizziness is coming from. So if you are seen in the emergency room, which is, again, usually where it starts, once you get through the acute phase of that, you will, if it really does persist, you will end up having a VNG. Which again is covered by insurance. It's not painful. Sometimes it's a little unpleasant because we do try to stimulate that vertigo, but it's very controlled. We also stimulate it. We can fixate it and make it go away. So I trained the procedure for years. I probably taught 1,000 people how to do it, but I no longer do it in our office. You guys don't do that, right?
We don't. No.
We refer out, but
Yeah, yeah. So again, it's a diagnostic procedure essentially to figure out, you know, what is exactly causing, you know, your balance issue. So anything else I should talk about there?
Well, actually,
Falls?
one more thing on
Yeah.
the VNG. Ironically, even if your VNG is negative for BPPV, sometimes you do quite well with an upward
Even with the
maneuver.
uplink?
Even
Really?
Yes.
Okay.
So it is good information, but sometimes there's it still really does make a big difference.
So I think for those of you who may watch this and you're like, well, I do have balance problems, but I think it's just because I'm, you know, 82 or I don't see as well. I think there's opportunity to maybe get a little more information. Again, I think if you're thinking about your eyes, if you're thinking about your hearing, which is why we're here, and if you really are struggling, the reason I have them here today is because there really is help for you, for a lot of people. And I will tell you, I've actually seen both of these doctors privately over the years for different reasons, and that's part of the reason I invited them, because I'm like, hey, I know them, and they both do really great work. I've sent lots of people to you, and I've actually seen you myself privately. So they really do great work, and I think what's really nice is you kind of have an idea of what the plan is, where you're going, and sometimes how long it's going to take.
Sure.
I know you can't guarantee anything, but I know every time I've been in, I've seen improvement every time. So for me, that's a high recommendation because, you know, you don't want to waste your time, and you want to know if hope is realistic. And I think the reason I wanted you guys to I wanted to have you here today is hope is okay, because there is lots of treatment for this, even for my patients who have the vertigo. And then just for some of my seniors who really struggle with balance. And I think a lot of people don't reach out and get help because they don't think there is help.
Yeah.
And if you could be more active, would you? And I know most of my patients, the answer is absolutely.
Oh, sure.
Absolutely.
It's all about
And
maintaining independence.
You don't know that a physical therapist could help you. Like if it's just, I'm 85 and that's just part of getting old. I think people would be very surprised at what benefit you could see in physical therapy services and some of these exercises we've talked about today. Where are you located?
In Gilbert. Crossroads, Gilbert Road in Guadalupe.
So for those of you joining us who have seen me in my Gilbert office, they're actually in that complex. I mean, I have 3 offices, so we're different locations, but they are located in Gilbert. And again, you've already said insurance, most insurance companies are accepted, and I didn't know, what'd you call it, a free?
We have direct access.
Direct access. I did not know that about Arizona when it came to physical therapy, which means you can just call their office and say, I would like, an evaluation, a consultation, and they can see you. There is a website, a phone number, if somebody wanted to reach out to you.
We do. Our website is www.bustillopt.com.
Okay.
And phone numbers 480-892-0808.
And that's Bustillo.
Correct.
Bustillo Physical Therapy. And again, I can really speak highly of both of these doctors. They've seen, I've been sending patients there for years, and they've seen my family members, and they've treated me. So if you are struggling with balance, if you're my patient already, give me a call, and I'll try to help you ascertain whether or not this might be an appropriate referral for you. But I don't think it ever hurts to ask, especially if you're just struggling with just the average. I just struggle a little bit with my balance because there's help. I mean, it really can be made better. So please reach out to myself or one of these doctors at Bustillo Physical Therapy. I want to thank you guys for joining us. I told you it flies by. It goes very fast. So cheers again. Thank you for joining us.
Tina.
Thank you for having
again,
us.
our wine is a Pinot Noir from Raptor Ridge in Oregon. So thank you. Until next month, we'll see you then. Thanks.